Today, we are going to have a really great treat because we're going to be talking with a special guest about adolescence, which is teenagers. We're going to be dealing with teenagers today. Welcome to the Dr. Dean Show.
Dr. Dean Beckloff has been working as a counselor with students, families, kids, and teens for over 40 years. As the founder of the Beckloff Behavioral Health Center, Dr. Dean focuses on children and families that need a little extra help via counseling. Each week with Dr. Elizabeth Zach, we discuss all things family related to help people create the positive family they want to build. Welcome to the Dr. Dean Show.
Today, we have a very special guest, and this person is our Director of Adolescent Services. And again, we're talking about teenagers. And our director is Ashton Rone. She's been with us several years now. And she, probably when she started counseling, like many of us, wasn't really quite sure what was her niche, but soon discovered she was good with teenagers and dealing with some of those issues. So we're so glad to have you, Ashton. Thank you for being here and sharing with us some of your insight about teenagers. So, and how did you become interested in working with this population? What was it, that kind of thing where you began seeing this works?
Yeah, like you said, when I first started counseling, I wasn't quite sure. I knew in my background from volunteering with with adolescents, I really enjoyed that population, but I was like, hey, maybe I want to do more play therapy. Maybe I want to make slime. I quickly learned slime is not my passion. But I realized teenagers, they have all these feelings and they want to express, but sometimes there's this barrier where they feel like they have to be too cool, or I don't know if I want to open up. Being vulnerable is hard. And it's really rewarding to see that change of, oh, I can open up. Oh, I actually really do like talking about my feelings.
Yes.
And the more I did it, I just realized this is a passion of mine, and it kind of grew from there.
You know, I forgot that you had worked with teenagers in a church setting, right?
Mm-hmm.
And was that for a number of years?
Yeah, I did it some whenever I was in my early 20s.
Uh-huh.
And yeah, continue to do so today.
That is fantastic. And then you do that at work.
Yeah.
Too. Yeah, and you know, I think you understand the mind of a teenager, number one, and then number two, you're strong in taking care of business too, and which is why she is our Director of Adolescent Services. Anything else in terms of working with teenagers that has been striking to you, that got you pulled in more and more? Was it the work at your church that really kind of solidified that, or was it just a combination of all of it?
I think it really was just a combination of all of it. You know, I think one of the things that's really special about our office is that we do have the activity therapy. You know, the number one response I get from my teenagers, especially my teenage boys, is, oh, I thought we were going to have to sit and talk about our feelings, and I was so nervous about that. Instead, we're playing pool, we're playing ping pong. I have a Wii in my office. I try to make it very almost informal to where they're in their element. There's not this stereotypical, you know, they always make it sound like it's like that cartoon that you see where they have the clipboard and they're like, please tell me about your
on the
feelings.
couch.
Yep.
Yeah.
And I really try to take that away. And I make that joke. I'm like, if you want, we can do that. And they're always like, no. So I love that we can meet them where they're at, to where there isn't a stigma. There's not this pressure of, I'm bound to stare into your soul and make you tell all your feelings right now.
Yeah.
Yeah.
And you bring up a really good point, because we do have that kind of a facility where we have a lot of things that teenage kids, I mean, they're not kids, but teenagers can interact with you on and get to a place of comfort and being able then to spill their guts.
Yes.
So
When you mentioned pressure, the pressure to sit on the couch, you know, I was thinking about, it's been many years since I was a teenager, but the pressures that I faced as a teen very, very different than what we're seeing today. I think certainly, the pressure to fit in, very common, during this time. But so many changes and worries and stressors that I think our teens are facing today. What kinds of things are you seeing from your teen clients that seem to be, pretty prevalent?
Yeah, some of the ones that we're seeing, of course, there's always going to be depression, anxiety, although a book I'm reading right now just said that depression is up 200% since 2010.
Yeah.
And I was a teenager in 2010, and I remember it being hard
Mm.
back then too. So the fact that it is so much more prevalent is almost terrifying because these kids have extra pressures that we didn't have.
I don't think I knew what depression or anxiety was as a teenager.
No. And no one talked about going to counseling. You were just the sad kid. No one talked about those things. And today, we have not only the diagnosis, but also, the strive to be perfect. Teenagers now, you're not allowed to not have a 4.0 or have the best friends, be in varsity on all your sports, get into the best colleges, have good friends. Partying is a huge thing with the teenagers nowadays. It's one of those, okay, if you go to a party, what kind of persona are you going to have? How to be safe with it, relationships, friendships. I mean, it truly, if they're not put together in this nice bubble, it almost feels like they're falling apart. And on top of that, social media is a huge thing that's on play.
Yeah.
And that's part of the reason why I do think depression and anxiety is so elevated, is because everything they do is talked about. Snapchat is probably the number one app that my teenagers are using right now. And even in session, they'll be getting alerts. They'll be like, can I just send a quick message? Or hold on, I'm in a fight with my best friend right now. Can you tell me what to say to them? Because, I need to tell them I'm right. Not the greatest, but they're constantly plugged in.
Yeah.
They almost need, I've had times where in sessions, I'm literally like, give me your phone. We're putting it aside because they are so attached to it.
Right.
And even though schools have put in like yonder pouches, which are these things to lock it up, all they do is turn in old cell phones and keep their own. So they're constantly going and connected.
Yeah. We've been talking as an office about the book that's out, The Anxious Generation, John Haidt. And I think if it's such a wonderful read, especially for parents of young children, right? Once they're teens, they're already kind of, have developed some of these habits. But he talks about, what happened in 2010 and smartphones is what happened in 2010. And, what we're seeing, sleep deprivation for our teenagers, the social, deprivation because we're not connecting face to face. We're connecting over this device. He calls it attention fragmentation, that not being able to focus in session, in school, anywhere during homework because of those pings, those notifications, and then addiction, right? These teens are truly addicted to that device, and adults too.
I have an idea that there's a lot of parents listening to us that would agree with you wholeheartedly.
Yeah.
Because that's one of the things that we deal with as well as the parents who are concerned about it.
Absolutely.
And do you work with the parents as well when you're working with a teenager?
Oh, absolutely. I think sometimes the mindset of some therapists is, oh, teenagers, I want to protect their confidentiality. I'm not going to talk to the parents at all. But the thing is, parents need to be involved. They don't need to know all the nitty-gritty details. But for instance, like I work with a lot of angry teenagers. Part of the things we teach is like when you're angry, to go walk away and cool off instead of exploding. Well, if a parent doesn't know that they're walking off to cool off and not to explode, they think they're being disrespectful. I've gotten a phone call. They're like, I can't believe, they did that. And dad sided with them. And I said, remember, like, that's actually a good thing that they're walking away. So if we're not communicating with the parents on what we're teaching in session, parents can't grow with their kids. They want to be involved in their teenagers' lives.
You got it. They want help. They want some suggestions. I think you hit on a couple of things. One is parents who else knows this teenager better than the parent? That's one of the reasons why at our clinic we want to bring in the parent. We want to know they know this kiddo. And number two, they probably have the best relationship. It probably doesn't feel that way many times, but it is there. So I think learning how to take advantage of their strengths to help their teenager grow up.
And a secret that teenagers won't ever tell their parents is they desperately want a good relationship with their parents. They recognize when their parents do something that they love. They'll never tell them. I've never gotten a teenager to actually tell their parents they're doing a good job. That's still a thing in progress. But they value their parents' opinion so much. So when their parents are disappointing them, they feel it. They internalize that. But to counter, when their parents say that they're proud of them, they'll come into session just gleaming and so excited. So that's why we have to have these parent meetings, because parents a lot of times do get a lot of the teenage angst and the ughs when, hey, your teenager actually is listening. They actually are taking what you're saying. And so we want to help mesh where they're growing together.
I think, Dr. Zach, you would agree with me on that point right there, which is I had teenagers, and what I found was there was resistance to whatever I might have been preaching about. I'm sorry, I tried never to do that, but, I would give them some of my fatherly insights, and they would reject it.
Sure.
Talk to the hand. But then I found that they were integrating that into their life. So that's a great. And did you find that to be true too?
I have.
I said, did you still?
I have two teenage boys. I'm living this, and there's no question. I think you raise a great point. They may appear right that they're not engaged, or that they're not hearing you, or that there is that resistance or that anger. But then you see it later, right?
Yeah.
You see that they have received that message. And I will say too, there's plenty of times where, and I think parents find this, a very common kind of occurrence, where I could say something to my teen boys and it'd be spot on and what they need to hear. They may not hear it from me. They may hear it from a coach, right? They may hear it from a therapist, a teacher. And so I think, having that safe space.
And I think that's a point that we can make to parents is have faith that there is some listening going on, that your words do matter, that what you say does count. My mother used to call it in one ear and out the other, and she just would get so mad about that. However, it doesn't go out the other ear.
Yeah.
It does lodge in there, even though there are many distractions that kids are dealing with that we've been talking about in terms of the phone. Now, what about the issue of confidentiality? Because that, to me, is also what we need to look at with regard to parents. How do you deal with that? What do you do in terms of what you say to parents?
Or don't say to parents.
Or don't. Yeah.
The key I've learned a long time ago is whenever I talk to parents, I always let my teenagers know first. And we talk about what's going to be discussed in a parent meeting. I tell them, the first session, hey, these are the limits of confidentiality. And, some of the first questions are always like, okay, so is partying on confidentiality, or what about date? They want to know really, what are you going to tell mom and dad? And I tell them, anytime I speak to mom and dad, you will know first. We're going to talk together about it. So if we feel like you're getting to a point where things are unsafe, we're going to say, okay, do you want to bring mom and dad in, with you? Do you want me to talk to them? Do you want me to do a phone call? What makes you most comfortable? So that way you know what's being relayed. And then I also ask them how they want their parents to react to them after the information. Do you want your parents to kind of go on and pretend that they don't know it? Do you want them to have a follow-up conversation that day? Because the more that the teens are mentally prepared, they are on board with it. I don't have teenagers that are against the parent meetings once they realize that they have a say in them.
Yeah.
And so I follow their lead.
Yeah. I love it that you're so open with your, I hate calling them with your people. your folks, your kids, but they're people.
Mhm.
And that they get to have an insight about what's going on, and you tell them that you can, you're going to take care of them. You're going to take care of them. What are some things that you would have to speak to parents about? What do you tell them is going to be something that we need to talk about?
Sure. I mean, of course, the limits of confidentiality is if someone's hurting them, they're hurting others, or they're hurting themselves. Of course, that's like the baseline. But I've also had conversations where maybe the anxiety is really heightened and they're having a lot of struggles at home and they want mom and dad to know, but they just don't know how. We'll talk about talking to parents about that. Or with like partying, let's say we're taking it way too far and we're making some dangerous decisions. We're going to bring mom and dad in to have those conversations.
Yeah.
Mhm. But again, it's when we both agree that it's not safe and we need to kind of let mom and dad in.
Yeah. And so I guess, does that relate to, like, if you hear about drug use and a lot of alcohol consumption by the teen, is that something that you bring in and start working on bringing parents into that picture?
And it's a hard fine line.
Yeah.
Because yes, our teens are engaging in risky behavior. Like that's
Right.
part of adolescence is, alcohol, drugs, sex. All that is a thing that is very prevalent in the teenage world.
I mean, I'm sorry. We engaged in risky behavior when I was a teenager.
Changed.
Yeah.
That hasn't changed.
It
A lot
did.
of things
We
have
did.
changed, but
Yes,
that hasn't changed.
we did. Yes.
But I do tell them, hey, I'm not your mother. I'm not going to lecture you for doing these things. But if you're going to do them, we're going to talk about safety. So I do a lot of safety talks of, okay, if we're drinking at a party, then we're not driving. Who's going to be your designated driver? Does mom know? Okay, if we're going to vape, I'm going to let them know, hey, I used to work in a hospital. I saw kids come in with illnesses caused by vaping.
Mm-hmm.
So I'm going to be honest with them, but I think I can be honest because I like to say with my little kids, if I make them feel safe, I earn their trust.
Yeah.
With teenagers, you have to earn their respect first before even trying to earn their trust. And so because there's already that respect there, even if it's information that they're maybe kind of rolling their eyes or they don't always love, they know that it's coming out of a place of love, out of a place of respect. And so they will still take that information and apply it because they know it's not someone trying to, wag their finger at them, but rather try to lift them up.
Exactly. We're trying to bring good relationships into the teenager's life. And that means also good relationships with their family and their parents. And we want to support that. That's really good. I love that.
Yeah. Wondering if we could talk a little bit about maybe what you're seeing with regard to gender differences. If you're seeing, maybe things that the guys are bringing to you as pressures and worries and stressors, and maybe, differences in what you're seeing with our younger ladies.
Yeah. It was really eye-opening when I did start working with teenagers about the differences and the similarities. With my teenage girls, they really come in already overanalyzing everything. They will say, okay, this is what happened in the moment. This is how I processed it. This is how I'm still processing. Is this correct? They overthink it, and they a lot of times feel patronized for how they've been handling things. But to counter, my boys will come in and say, I don't know, they just really pissed me off. Oh, do you think you might be sad? No. And then when we strip the layers, oh, that did hurt my feelings. But I also do see a lot more tears actually from my teenage boys than my teenage girls, because it is a safe place. With girls, it's more socially acceptable to cry and be vulnerable with their friends, where with boys, not as much so. And so when they do have that safe space, I do see it a lot more. Body image, I actually see that equally between my boys and girls. My girls will do a lot of, I look in the mirror and I don't like the way I look, where boys will be like, I ate a hamburger today and now I'm feeling so fat. I need to go to the gym and work out for an hour to burn it off. And so they're both facing the same pressures, but they handle it differently because of how society almost says you have to handle it.
But that's always been my understanding when I've worked with teenagers too that they both deal with the pressures of body.
And I'm seeing it, with athletics,
Yeah.
where the coaches, right, are pressuring these boys to bulk up, or wrestling to, to lose weight. And these guys are struggling, with body image, with eating. They're, downing protein shakes and adding supplements and hitting the gym and worrying
Well,
about
these
those kinds of
days
things.
at the high school, okay, when I was in high school, we didn't have much in terms of equipment,
Right.
like gym equipment. I've been blown away at what is at the high school for these kids to be working out with, which is a message, right?
It is.
To the teenager, you need to look a certain way. Here's all of the equipment, and they have a lot.
Yeah.
I assume, now you may know this
No,
better than I do.
You're absolutely right. I mean, it is shocking. I mean, it looks like these elite
Yeah.
kind of training facilities in some respects. And the message is, right, that we need to be using, this equipment. We need to be bulking up and getting stronger. And, the guys, it takes a toll on their mental health too.
It does. And especially, we have to take account into puberty as well. My freshman boys will come in and saying, I need to bulk up, but, their body just isn't built yet for that. They're still growing. And same with the girls, they'll say, oh, I want to have a woman's figure. But again, their body hasn't caught up to it. And so then they start feeling really harsh about themselves because they're doing all the working out. They're trying to wear the right clothes or whatnot. But genetics, puberty, there's so many things at play, but these kids don't understand that. They're trying to match their peers. And especially for our younger teenagers, they see, the seniors or the college kids, and they try to be just like them. And when they can't, again, that really does tear down that self-esteem.
Absolutely. Even colleges have amazing facilities now. I mean, we sort of had something, I think, but it's just everywhere. Nearly every dormitory has its own gym now and
Right.
all of that. So we have a favorite book, Dr. Zach and I, but one of the themes in that book is a theme that the author calls emancipation. That is the cry of the teenage heart in terms of emancipation. I want to be free. I want to make my own decisions. And it becomes, I think, sometimes for teenagers, kind of I hate you, don't leave me with parents. But how do you address that desire for freedom and make my own decisions and all of that?
Yeah. Well, one, we have to normalize that it's happening.
That's good. That's that right there, even for parents.
Yeah. I think a lot of times parents sometimes do feel like there is a push away, and we have to explain that that's normal. But one thing I also teach my teens is also, especially if they're the firstborn child, this is new territory for your parents too, which to my own parents, I apologize. I've learned a lot being a therapist. But, they are also having to learn to let go because teenagers are like, why do they keep checking my homework? Why do they, keep doing this or that? And I tell them because they've had to for so many years. And now they're like, oh, I have to take a step back. That's scary because one of the things I notice is parents don't want their kids to fail. Naturally, you want to protect your young.
Right.
But teenagers almost have to fail to grow. They have to see what their limits are. And so that's one of the things I tell parents is let your kids fail. But to counter with our teenagers, hey, you also have to earn the right to have that independence. If you're not doing what you should, if you're wanting mom and dad not to check your homework, but then you're not doing it, then you haven't earned the right to be independent. You have to, it's a two-way street, right?
Right.
Yeah, absolutely. I think that's excellent. Well, let's shift a little bit. We talked about, just the growing numbers of, depression, anxiety, substance abuse, eating disorders, really since the 2010s. So you see folks in outpatient counseling. We see folks in outpatient counseling. How do you know when a kid may need something more than what we can offer in just general weekly counseling sessions? And then, what are some of those options for the kids?
Sure. Yeah. So sometimes whenever they come in and, are really down and they've been that way for a long time, if it seems like maybe medication isn't helping or just weekly counseling isn't enough, they're feeling that entire session. Or a lot of times, if it's because they're self-harming themselves or there's suicidal ideation or past attempts, then we always recommend a higher level of care is what it's called. And then there's different kinds. So the counseling that we do is kind of the basic level. That's where they see us once a week for 50 minutes. We talk about their feelings. They go on. And the next level is called intensive outpatient, IOP. That's where they go every day for about 3 hours, typically in the afternoon, Monday through Friday. And it's a mixture of individual, group counseling, family counseling. And they're really focusing on all the aspects that we're doing, in our normal sessions, but just a lot bigger version of it.
Intensive version.
Mm-hmm.
Yeah, daily.
And then PHP, which is partial hospitalization program, is where they would go about the normal hours of a school day. And they would do their schoolwork there. And again, all the therapies I mentioned in the IOP, the individual, group, family. And then inpatient is where they actually stay the night. So they're typically there for about anywhere from 3 to 7 days on average. It could be more, it could be less. And that's typically whenever they're not safe to be at home. I see a lot of that when they are suicidal and they're like, I feel like I can't be safe at home. Okay, then we need to go there just to help make sure that, nothing happens while you're getting the therapy. And I should backtrack and say the IOPs and PHPs last anywhere from 3 weeks to 8 weeks.
Okay.
Again, it could be longer, it could be shorter. It just depends on the kid and how much they're engaging, how much they're growing from the process. And then the top level is residential. That's where they go for, anywhere for a couple of weeks to a few months. And
to
again,
a year.
To even a year, yeah. Luckily, I've not had any kids who've had to go for that extent. But yeah, it is possible.
I guess that would be maybe where you hear things like wilderness kinds of, I guess, adventure kind of things, but I don't know.
Most residentials are kind of what you would expect, where it's a group society almost, in a sense where, the boys and girls are separated and they just do a lot of intensive therapy.
Right.
I also see this sometimes with behavior issues because I know the wilderness ones are more geared towards behavior. But let's say that they're participating in a lot of risky behaviors and they have maybe some mental health going on as well, some depression, but we're also acting out. Sometimes the residential is there to help kind of get it all in one place where they're safe. They can really focus on themselves without the outside pressures.
And the outside pressures is their environment.
Mm-hmm.
And so I assume that's about pulling them from that environment and putting them in a different environment where maybe they can grow and not be pulled in by the influences of their environment.
And then I know this. So they complete the program, whether it's intensive outpatient, whether it's all the way up at residential. And then the hope is, right, that they can get plugged back in to outpatient counseling.
Yeah. One of the things I love about a lot of these facilities is they really do try to have communication with the outside provider, aka us. So that way we know exactly what they've been working on. When I've had kids who I've recommended to go to an IOP or PHP, I always find out who their therapist is there, and they give me weekly reports. When they come out, I get the discharge summary to know what they've been working on, what medications maybe they've been put on, all the things. So that way, when they come back to regular counseling, we're not having to play the like, oh, what did you learn? Oh, you already know that skill. No, so that way we can literally just jump back in without missing a beat.
Right. Well, this has just been enlightening, and we so appreciate you, Ashton, for coming here and sharing some of your amazing intellect, but also experience and, how parents can help their kids. And we really do thank you for what you've done for us today. Again, if you have any other questions, you can go to our website, www.drbeckloff.com, and we have a lot of helps on the website as well. And then certainly you can give us a call at any time, and our number is on the website as well. Thanks for being here with us, and we'll look forward to the next time we are all together.